Good evening, everyone from London, and good morning and afternoon to wherever you are. We have more than 100 participants registered for this evening's webinar. This is the World Hepatitis Alliance's Tools for Change webinar series. This is the third we've held, and today we'll be addressing awareness as a policy lever. We have a very exciting agenda tonight. We have 4 speakers joining me. I'll be chairing the session. First, we have Raquel Peck, the CEO of the World Hepatitis Alliance. Thanks for joining us, Raquel, and thanks for really being the motor behind this series. We have Martinez Vargas, the Vice President of FupaHep in Chile, and FupaHep is a member association of the World Hepatitis Alliance. Bienvenida, Monica. We have Elizabeth Nyamayaro, the Senior Advisor to the Undersecretary General of UN Women and head of the HeForShe initiative. Welcome, Elizabeth. And we have Farrell, the Communications Manager of the World Hepatitis Alliance. So we're going to be looking at, policy awareness as a policy lever, and Raquel is going to start off with an overview of what this means, how she understands it, and then we're going to take a dive right into a local organization's perspective on this, where Monica will tell us about the work FupaHep has been doing in Chile. Then Raquel will bring us back to talk a little bit about how the Alliance has been using social media and how all of you and all of us can use social media to create awareness, and particularly as a policy lever. And then I'll skip. Before we hear about the very exciting global elimination movement, we're going to hear from Elizabeth about the HeForShe movement, which is a really groundbreaking initiative around gender equality from the UN. And as I mentioned, we'll close up with Tara introducing the new global hepatitis elimination movement. Before we begin, let me remind everyone, including the panelists, that we want the session to be as interactive as possible. We encourage all of you to send in any questions via the webinar technology that Chrissy was explaining. You can also send in via Twitter using the hashtag #ToolsForChange. So let me turn over to you, Raquel, to take us through awareness as a policy lever.
Thank you, Jeff. As Jeff mentioned, and this is just an overview, really. The intention is to keep things brief so we can have that discussion. But throughout this webinar series, we've been talking about different ways to drive policy change, right? So webinar 1, we're talking about how to use high-level documents, and webinar 2 about generating data and the power of surveys to advance our advocacy work. So now it's time for awareness. And what's important about awareness is without awareness, we have room for misconception, stigma, discrimination, lack of interest, lack of support, lack of commitment. And this actually rings very true to us at the World Hepatitis Alliance, because when we were created back in 2007, we had a world where there was minimal awareness around hepatitis. We had, as I said, zero global commitment to tackling this disease, and where you have departments at WHO, the World Health Organization, taking care of diseases like HIV and malaria, there was not one single person within WHO looking at, in a full-time position, looking at hepatitis, a disease that kills more than malaria and HIV, for instance. So for us, it was very important to shake things up. And the first thing that the Alliance did was to create an awareness initiative. So World Hepatitis Day was born, and to really mobilize the community to make noise and make noise together, to really create that and push for change. And I mean, look how far we've come. Now, I certainly don't mean to credit all of these advances that we had in the field to a single awareness initiative, but I think that we all have to agree that, by unifying our voices and making noise, I mean, that played a big role. Now, I think that it would be very interesting to perhaps get, and speak to Monica a little bit more about, her perspective, because at a national level, it's also very important to see how that works. But just before I go to Monica, I just wanted to say that, I mentioned World Hepatitis Day, and this was crucial, but This year we are talking about elimination as a goal for the first time for our disease area. And what we're thinking about doing is catapulting awareness to a whole new level, right? So we are thinking about taking World Hepatitis Day and throwing it out there and really splashing out with a big movement. But again, this is something that Tara's going to be talking about, so I'll just stop now. And I said I was going to be brief and maybe ask Monica if you could give an example of how, you're driving awareness in Chile.
Monica, so I know that FupaHep is a very young organization, and you've already made quite a bit of noise in the field of hepatitis, and I've also seen you at global meetings. So I'm really excited to turn over to you to hear about your work, the awareness work, and how it can help drive policy in Chile, and also think about some of the lessons that we can learn for other associations.
Great. Well, thank you very much for the presentation, and I totally agree with Raquel that making noise together is the key for success. And then definitely what we've done so far, even though we had this is definitely what we've done so far. We have at the beginning, because we're going to give a little comparison before and after the demonstration. Before, we did a lot of work, a lot of energy put together, and the idea was to be able to catch up and get some attraction from the people, from the Minister of Health, and from the people from the social media as well. And we did a lot of extra work, a lot of work together, but it was not as effective as today. So we compare what happened before the demonstration and after the demonstration. We've done a great progress because we grabbed the attention of everybody. For example, the first meeting that we have with the Minister of Health, they promised a lot of things, and we put this on writing, and nothing happened. And our second visit to the Minister of Health, without any agenda, without any, they were not expecting from us. We just came over with the whole family, the whole FupaHep family, all the patients, everybody over there. So at the same place that we were doing and waiting for them to listen to us, because we're making a lot of noises in the streets, then we said to the front office of the Minister of Health, we're not moving here until you guys come over and listen to us. And somebody gave the space. And that was very key in then turning the point, as they know that we were all online together. We're making noises, but we have a very clear agenda. So on this demonstration, there's the pictures that we see over there. Not only the patients came over, but also their families, and a lot of members joined us. And every time that we have a public presentation, we come together with a real list of things that we like to the media to pay attention. So everybody that started coming over, people from the radio, from the TV, we give them the same script, so they all have the same information. So in case they start publishing this, they're all aligned in the same message. So if we go into the next slide. So other thing that was very interesting here, and the first picture we have the first meeting with us, that nothing happened really, and then the second picture we put together as we were in the meeting with the Minister of Health. People on the first floor were making a lot of noises and a lot of sounds and music, and bringing attention to everybody. And then started the media coming over. And then people up there in the meeting were asking us, what's going on over there? Why they're so noisy? I said, no. There's all the patients and their families waiting for us to take a decision and, bring them good news. So that also helped us to say, you know what? Well, they're not by themselves. This is not an structured movement. They're all aligned. Specifically when we mentioned that we're very close together with the doctors, very close together with the media, so they were waiting for us to give them some information, and we're not moving until they give us some answers. So they moved this meeting, the same meeting, for 4 hours. They keep moving the meeting, but we started making such a big noise that they really didn't cancel the meeting, and they give us at least, the option to talk to them. So I think that was one of the key things. And in this picture, you see other key elements that help us a lot was to find a very well-known face. In this case, it's a football player that he has hepatitis C. He's from Chile, living in Brazil. So he helped us a lot through the media, through Twitter, and all this information. That everything that we have some movement or any meetings, he was, helping us to promote this as well. So those are the things that I will say that is very key. And I don't know.
Can I ask a quick question?
Yes.
Was the media responding more to the fact that you had a celebrity with you, or were they equally happy to interview patients? Because there's that hunt for celebrities to help with the cause, and not all organizations that we know of in different countries that have access to national celebrities backing the hepatitis cause. So I just wondered if you felt that it was, key to have that celebrity there, or if you didn't have it, you still would be able to make noise with the patients and organize. I mean, do you think that it was actually key to have the celebrity?
No, I'll say that key for us it's been getting all together with the patients and making noises. No matter what, 10 people at the beginning, 20 people, but all of us align is what makes the difference. Well, maybe this, face and public faces help us a lot, but it was not the turning key point. Yeah, good question, Raquel. So maybe, I don't know, maybe you have another ideas or any other examples with these movements really help in moving forward and facilitate the people listen to us faster? Do you, anybody of you guys have another idea or any other example? Sarah, maybe you?
I think what you, for an example of different ambassadors and celebrities, we see them right across the board. Last year at our for the 4,000 World Hepatitis Day 2015 campaign, the 4,000 Voices. I know Raquel's going to talk about it in a little while, but key ambassadors or key celebrities, spokespeople like Stephen Fry and Richard Branson came involved and really lended their support on social media platforms, which helped obviously push the message into a new sector and reach a new audience. And I think that's what's very important for celebrity spokespeople. But I think you really touched a great point there about collaboration and really nurturing the relationships with different stakeholders like medical professionals and media, and keeping those, not only just going to them once every couple of months with a press release, but ensuring that they have that message and that you're telling them a story. I think that's something very interesting and something that we do quite a lot, Raquel, as well.
Yeah, and we didn't have, I just want to, we had some support on the day, but what we lacked still with our cause is engagement. So we had the celebrity support and, there was Twitter exposure and all that, but we don't have, per se, an advocate, a celebrity advocate for hepatitis, someone that's constantly pushing the agenda out there and promoting the cause. So hopefully, we will get some with, our new movement. But
we're going to hear a little bit more about that also later, because I think there's different kinds of celebrities and representatives. Some are these bigger, important celebrities who reach the general public and so on. But, Tara mentioned, I know you're doing this in Chile, Monica, having a celebrity within their field, a leading medical professional, someone who the Ministry of Health, payers, and others might listen to. So I think one can reach celebrities in a whole bunch of different ways, depending on what the tactic is.
Yeah, that's that thing. I'm going to show you the last slide here. Just like a little key points that maybe help us a lot. Having a plan that we all share with the doctors and receive their feedback, with the patients, with the key leaders that we have over there developing this month, and then also getting the feedback from the pharmaceuticals, see how much they can collaborate or not. So it's the whole stakeholders, everybody that has something to say, getting your feedback is very good. Building this network, as Raquel mentioned, and also Jeff, it's very, very powerful. As you have every time that we're going to be part of this, any TV show or any radio show, we work as a team, and then we come one patient, one also doctor, so we come together ready for all type of questions. So that's also been helping us a lot. We got this campaign, prepare any campaign that you have ready, and then be consistent with this campaign. We mentioned the public face, even though it helps a lot. Through the media also, you can find other people that can start joining us. At the beginning, Raquel, you mentioned that the stigma is big in this hepatitis C. And then once they start feeling that there's a robust group helping here, they're willing to help and support with their stories too. That happened to us, and a lady that's very well known in the TV. She has hepatitis today, and then she starts sharing her information. And today she's one of our helpers in communication. So we have a lot of people, and the big family is growing thanks to people that's not afraid anymore. And those keeping those media relationships very strong is also key. So once you have one attention to one of them, you send them the same message to everybody, so they start publishing in different magazines and things the same information. And collaboration, again, that's key. So here we have to collaborate all together at a global level. So that's it.
Monica, you mentioned a plan. So is this a national plan, or is it a plan from your organization, from FupaHep?
It's a FupaHep plan that we have together. And then I think in the Glasgow we mentioned, Raquel, maybe we should put it like a South American, plan, and maybe start sharing not only plans, but also maybe some resources. As we have, lack of resources, we can start sharing campaigns and things, and we can use them in different places. As we already know that they're true, they're good, and then maybe we can share those globally. That would be wonderful, yeah.
I asked because a few years ago when the World Hepatitis Alliance and WHO collaborated on the first global hepatitis policy survey, it was found out that the vast majority of countries in the world didn't have a national plan or a national strategy. So I was just wondering what you were referring to there. I think things are changing really fast, as we're going to hear. And with that, let me turn over to you, Raquel, to talk a little bit more about creating awareness, and specifically from a social media perspective.
Oh, okay, right. So, and again, this is not a presentation about the importance of social media, and I'm aware that we have different types of audience here, and some of you know about Twitter, some not. So I'm not an expert myself, but I think that the idea here is to really validate that social media can really help disseminate awareness. And just as an example, I wanted to use our campaign from last year just to illustrate that. So we had, as Sarah mentioned before, a campaign on World Hepatitis Day called 4,000 Voices. And in order to, I think we can say it was a success. And in order to make it a success, we were counting on very interesting images. And we did have that celebrity backing, which did help, but also interesting content and a message that people could really rally around and get behind. And I think that was very important. And just to mention one of your achievements, we had about, I think, a reach of 341 million people, which for our field was quite big. And compared to previous years, there was about 144% increase. So the importance of getting your voice out there, and again, remember the power of social media. It's massive and it's free. It's a free tool. That slide is just to talk about something called Thunderclap. Again, another tool that we used that really helped us, and that you can perhaps use it too. And it basically allows you to get one single message and really expand it massively and get a lot of people supporting, and your campaign is then elevated by using that tool. Finally, just a couple of tips on using social media. The first one there is about, mainly about Twitter. It's about the use of common hashtags. So that hashtag #NoHep is coming. Again, don't want to get into Tara's presentation, but guys, check out that one. But develop and localize materials. Again, the power of images. Images are very, very powerful. Staying connected with similar organizations, connecting with media. So nowadays, we see that you open a newspaper, and now you have the name of the reporter and their Twitter handle. So you can actually reach out to people that are writing about health issues and start a dialogue with them online. But sharing regular stories and updates and having conversations are also very important. And I guess my bit around social media, I wanted to hear more, and I know that Elizabeth is coming, but I know that HeForShe is being massive and had a massive online presence. Perhaps she can give her, her opinions around it and how social media helped their campaign as well. But I'll stop here because I want this to be more of an interactive discussion. But that's social media is here to stay, and we need to grab the opportunity.
Yeah, thanks, Raquel. So I know from being an avid Twitter user, maybe too much of the time, that the World Hepatitis Alliance is very active on Twitter, and that's fantastic. Of course, for many of your member associations, Twitter can be a bit of a challenge, requiring connectivity. I mean, you mentioned it's free, but you still need a computer and an internet connection and so on. Monica, how about in Chile or in South America more generally? How are you engaging on Twitter on hepatitis issues, or are we not really there yet? Oops, we lost your sound. There we go.
Can you hear me?
Yes.
Now we can.
That Twitter is big here as well, and helping us a lot to promote all the events and everything. People adding us. Specifically today, not a lot of people tweet, but a lot of people do Facebook. That Facebook is helping us tremendously. Yes.
Okay. And what else? I don't know. Tara is here as well. You're going to be speaking soon. But what else is the Alliance using in terms of social media? Because we have the big two of Twitter and Facebook. But I think young people are using Instagram more. There's platforms I don't know. There's blogs and so on.
And that's a really good question. First and foremost, we have to think of our audience, and that's what we do with the World Hepatitis Alliance. LinkedIn is a very influential network, and we see a lot of medical professionals engaging with it and creating conversations on it and linking with certain people and different discussions. So, and then obviously, as Monica said, Facebook is something that we really use as a channel to promote the stories and initiatives from our members. We like to hear, we like to see this, we like to see imagery. We really push out kind of more story-led conversations. And then obviously Twitter is very quick, very information-led. Obviously there's also Instagram and there's Weibo in China, and there's quite a lot of platforms. But the one thing that we would suggest from the Alliance point of view is about knowing your audience and then finding out that channel. And if anybody out there would like to know a little bit more information about what kind of channels for who and what, get in touch with us, because we're very happy to help navigate the myriad of social media platforms.
Yeah, I mean, when you're working with, go ahead.
Well, let me share another thing. I know a lot of people is jumping into the Twitter and Facebook and everything, but even the regular email is helping us. Remember that when we put this campaign, with all the patients and all the families and friends, we're sending the same email to the Minister of Health of different departments. We just log their emails, and then people say, well, please tell your people to stop sending emails. So that's also another tool that, the old-fashioned one still helps.
But it's funny you mentioned that, because there was a question that just came in that asked something to the extent of how did you manage your messaging? Because I can imagine, you want to raise awareness about hepatitis, but you also don't want your family members and your patients and so on sending mixed messages or even the wrong messages. People confuse the different kinds of hepatitis. They forget if there's a vaccine, there's a cure, how effective it is. So you had sort of a template email to use that basically just overwhelmed the ministry.
That helped us a lot. Yeah, that was good.
Oh, very good, very good. So I think, while we wait for more questions to come in, that it'd be interesting now to turn to you, Elizabeth, from the UN and from the HeForShe initiative to tell us about your work. I mean, before we hear from Tara and the hepatitis-specific global elimination movement that we're so excited to hear about, and that's really being launched in a way through these webinars, it'd be great to hear about your movement, and we want to know everything, how, but how did you get so successful? It seems every time I hear of an element of a movement, you did it.
You got the recipe.
Wow. The recipe is 3 easy steps, So over to you.
Wow, thank you for the big compliment. I don't think we've done it. I think we're on our way to doing something. But I think before I actually tell you a bit about the HeForShe, I want to start with a story which sets us into context. So I was raised in a small village out of Zimbabwe, and in my village, I noticed gender play out in such significant ways where the boys in the community went to school and the girls stayed at home. And fast forward a few years later, next door to Zimbabwe, there was an emerging leader. Her name is Kumzeli. She was a freedom fighter at the time and was instrumental in the anti-apartheid movement alongside Nelson Mandela. And it was, in fact, Nelson Mandela who appointed her in his cabinet as part of his first leadership role in the South African government. She later went on to become the first female deputy president of South Africa in 2005. And 3 years ago, she was appointed as the head of UN Women. And she's somebody I always looked up to. And so I found myself with an incredible opportunity to serve as a senior advisor about 2.5 years ago. And it was really during the first discussion with her in terms of what she wanted to accomplish as the head of UN Women that, my own personal experience growing up in an African village, coupled with my, years of experience within the UN system, including the World Bank, where, again, in all the work that I did, there was always a gender dimension that I noticed. And so we started talking about really what needed to change. I call it the rebel with a cause because she was literally a freedom fighter at the forefront of anti-apartheid. And it became very clear in this discussion that there was a lot that we could draw from both our paths. And in particular, her path is somebody who had understood what it means to create social change, what it takes to create solidarity. And she often says that it was not the Blacks of South Africa that ended apartheid. It was really the creation of the solidarity between the Blacks and the whites that ended apartheid. And so we wanted to look at, again, take a look at what could be done. Gender inequality has been there. The women movement has been really active. We have made great progress, but the progress is rather slow. And so really the idea was, how can we come up with something slightly disruptive, revolutionary, if you will, that looked at a new way of addressing the issue. So rather than make it a woman issue, but really make it a human rights issue and make it a men's issue too. And so this is what inspired the creation of HeForShe. And then we got Emma Watson engaged with HeForShe. And in September 2014, we launched this initiative. And I have to be honest with you, we had no idea what we were getting ourselves into. And in fact, there was not consensus around the idea of having men as part of this conversation. There were women, feminists that were very protective of this movement. They didn't want men to be part of this. They always thought men were the problem. And we decided that, perhaps it was time to actually make men as part of the solution. And so we launched HeForShe, and really the most incredible thing happened, which was in just 3 days, we had more than 100,000 men that had signed up to HeForShe. And within the first 5 days, at least one man in every single country in the world. So it was almost like taking a leap of faith and believing that there were, a few good men out there. And indeed, that was the case. And just one quick point on social media, during that first week of HeForShe, there was 1.2 billion conversations on social media. And most of those conversations were coming from men themselves that had sort of said, this is something that they had been waiting for. They were very excited to be part of a movement where they were welcome to be part of it and kind of had a role to play as well. So that's really the background of HeForShe, which is, it is an accelerator for the work of UN Women. It's an accelerator for the SDG goals. We know that we have to engage men across the entire UN system. It's not just gender. It's also looking at having more Malala fathers in terms of education, et cetera, et cetera. So this is really the goal.
Wow, I mean, we're gobsmacked. I mentioned my new. So happy you come with the billions. This is very. And you also mentioned Emma Watson, and I know we talked about celebrities. I don't want this to be all about celebrities, but how did you engage her? Because from what I see, you actually have, or what I mentioned we didn't, which is that engagement that. She apparently, from our perspective, she really took this cause to heart and she's doing it. Do you have any advice for us when we are trying to perhaps approach celebrities or get that support?
Yeah, so I actually think that the bigger question to ask is less about can you engage celebrity or how to engage celebrity. I think the biggest question to ask is, how do you engage thought leaders that are authentic and credible? I don't think we would have done this without having somebody who was authentic and a credible voice. And also, even in the engagement with Emma, I signed on Emma to UN Women, as first and foremost a goodwill ambassador of UN Women. And in my discussion with her, we set out some very clearly defined terms of reference. Here's what we want to accomplish. Here's what your role could be, but really looking for that very engaged, hands-on strategy with her. And as most of you know, she just announced this year, 2016, she's actually taking a year of filming so that she can focus on this work. So it's also having some very clear communication with the celebrity. And sometimes it can be a little bit, uncomfortable because you just want them. But I think you have to also think long term. Yes, you can have a one-off, and that doesn't hurt at all. But I think for the important work that you're trying to do to ensure sustainability, it's also important, I think, here and there to get people that are really authentic. And I think, Monica, your example of the celebrity engagement is an authentic one. He's experiencing the same things, so it becomes an authentic voice.
Yeah, it's really interesting.
I wonder, Elizabeth, when we're talking about awareness as a policy lever, I mean, you've reached over 1 billion people on social media, and you have an incredible celebrity, and on the website, the HeForShe website, you have a lot of actions people can take. But what kinds of policy changes, would you like to see?
Yeah, so this has been, so I'll tell another very quick story. Because when we launched HeForShe, it was really an awareness campaign. It was going to run for 1 year, and then hopefully there will be men that cared about this issue. But literally, as I mentioned to you, the immediate uptake of HeForShe necessitated that we took a look at how can we, if all these men are standing up and signing up, how do we also make sure that this is not just, click activism? How do we make sure that it's not a PR opportunity, especially for men in leadership positions? So we then went on 3 months later to create an initiative called Impact 10 by 10 by 10, which is a partnership with 10 heads of state, 10 global CEOs, and 10 university presidents. And the goal behind this is to create structure and systematic change across the 3 spheres, because we know that's where progress needs to happen. I think in order for us to at least have one of the first countries in the world or company in the world to achieve gender equality. So it was really about them identifying game-changing commitments that are measurable, that are, again, annual transparency around these commitments. But also what has been interesting in terms of policy, some of the stuff has come from the bottom up. I love to tell a story about a man in Zimbabwe who literally, after signing up to HeForShe, within the first month when we launched, he decided he wasn't going to wait for us to tell him what to do next. He literally went around his village. He handpicked all the men that were abusive to their wives, and he started a husband school to teach these men to be better husbands and fathers. So it's really been impressive to see how creative people can be when they're given the platform to be creative.
Interesting.
That's it. It's about the platform, I think, and that's why it's great to hear from you, because that's exactly the direction we are taking with the new step that we mentioned.
And Elizabeth, you mentioned, what do you see as the future for HeForShe? How do you see it being run? How do you see the movement growing and evolving? And how do you see it what's the next stage of awareness? You've reached so many people already. What's next?
So before I move forward, I just want to go back to some of the things that were important success factor, which I think will be important as we think about sustaining HeForShe and scaling it up. I think 3 lessons were very important to me. Number 1 was you have to know your role. I'm often being credited for having created a social movement, and I get rather embarrassed because it's inaccurate. I always say that I did not create a movement because people create movements. My role was that of a facilitator. So I provided a platform, I provided the tools, I provided a the name and toolkit so that people could own and run with the movement. The second thing that was really important as well is to have a clear and a simple call to action. People are being asked every single day to support this and this and this. And I think the more you make the call to action very simple and clear to understand, the easier it becomes for people. So that, again, was a very powerful thing for us. The name, I think, even the name itself, HeForShe, I think men understood what it meant. They understood what their role could be in this particular movement. And then the last thing I think is you have to think results. scalability and sustainability. So again, back to Monica, partnerships are critical. You have to work with local partners. They are going to be the ones that are going to ensure sustainability and scalability. So as we move into 2016 and beyond, with Emma having taken a year off, one of the things that we are focused on starting this year and moving beyond, it's really the idea of how do we start to generate solutions? How do we move away from raising awareness to now people are taking action, but to be able to then create what we hope will become the largest toolkit of solutions on gender equality, because right now there's so much discourse about the issue, and there's also so much really great ideas. From where we sit, we hear about the problems, what's not working, but also we hear some innovative ideas of what's actually working. So we want to be able to crowdsource for ideas on gender equality solutions, so that we start to empower people with more than just messages, but actual tools that they can use.
Yes.
Elizabeth, this makes me think that I'd like to ask you to think about how you can apply this, or how we can apply this to hepatitis. And let me pass over to Tara, because I want her to tell us about the global movement we're all, that's a big we, are trying to start now. And then it'd be great if you could chime in and give us some good, even concrete advice. And also everyone who's listening in, from large and small organizations, feel free. I've got a couple of pending questions to send in your questions and comments, and we'll get to them after Tara presents the new first global elimination movement.
Sure. Thank you, Jeff. And thank you, Elizabeth. I think we all can agree here today that HeForShe is very inspiring, and it's something that makes this kind of presentation, this discussion, even more pertinent to see actually what can happen through collective action. An interesting point before I go on is the click activism, moving beyond that and actually bringing it into the fore of people's consciousness. Great. So why a movement and why now? Well, besides what Elizabeth told about a movement and its importance about spreading the word, in terms of hepatitis and viral hepatitis, why a movement? Viral hepatitis, in the last couple of years, we've seen growing recognition. More and more people are now tuned into it and understanding what it is, and the actual, the burden of it. As Raquel said earlier on, 1.4 million deaths per year. That's more than HIV/AIDS or malaria. More and more people from global policymakers are starting to realize actually the impact that it can have, and that a solution does exist. Awareness is growing, but we can also see that across the Sustainable Development Goals. So for the first time, viral hepatitis was included as a development priority, which is a momentous occasion. Likewise, in 2015, the hepatitis community gathered at the World Hepatitis Summit for the first time, and there was a resounding voice. I think Jeff and Raquel will talk a little bit more about this, but there was a resounding call for a global movement, a collective action, something that unified the hepatitis community and really unified it to get to elimination. Now, 2016 is a critical year. In our first webinar, we heard from the WHO, amongst others, about the upcoming WHO's elimination strategy. This is the first ever strategy on eliminating viral hepatitis, and it outlines a set of targets and an overarching goal to reach elimination of viral hepatitis by 2030. This is fantastic, and it's definitely the time is now to leverage these commitments, ensure that political will and that commitment is achieved, and we can only do that together. And that is why a movement is important, and that's why it's now. So what we as I mentioned, this whole idea of a movement originated amongst the kind of civil society, the hepatitis community, and through collective voices and development of task force with World Hepatitis Alliance members and input from civil society, we have, as a group, have developed a concept entitled, No HEP. No HEP is a movement to eliminate viral hepatitis. It's a global social justice movement aimed at uniting people, bringing them together, speak up, take action, be engaged to reach this elimination target. So similar to what Elizabeth was discussing previously, the idea is that it will be an interactive platform where people are able to engage, able to share resources and materials, be able to use it as a backing from single advocates to larger organisations to really reinforce their objectives and activities. And as mentioned, this is a movement that's being developed by the civil society, by the hepatitis community, and therefore has the objective to evolve and develop what the community needs and as the viral hepatitis pathway continues. Overall, as I mentioned, just to reiterate, the movement is something that will be developing as it goes on. And similar to, again, what Elizabeth was saying, the idea of becoming a facilitator, identifying needs and priorities, and developing as it goes. It will be launched the idea is that it will be launched on World Hepatitis Day this year. That's the 28th of July, and it will run until 2030. To be very much in line with the WHO Global Elimination Strategy and ensure that these targets are met and that can help celebrate those achievements along the way.
If I may, Sarah, I just wanted to say that, just to even be clearer, because Elizabeth brings a great example outside the health, area, but for our members listening, what we're trying to achieve here is, what the Red Ribbon did for HIV, what Pink did for breast cancer, that kind of feeling where we get into a platform where anyone, anywhere, doing anything, be it a fundraising event, be it lobbying governments, whatever it is, they can do it under this platform. And by doing under this platform, people will immediately say, okay, this green no hep, it's hepatitis. I know what it is. And it has backing from millions of people. So that's what we're trying to achieve.
Agreed. So just briefly, what does no hep do? It connects people across the world, it lobbies governments and international organizations, it inspires people to tell their stories, mobilizes and campaigns. And then, as I mentioned, as it evolves, it will collect these voices and work together through collective action to achieve the elimination target. Now, as I mentioned, the idea is that no hep will be launched on World Hepatitis this year. And how you can support, as I mentioned, it's all through collective action. And Monica said earlier on, collaboration is key. Collaboration through all of us at different levels, in different countries, at different capabilities. If we come together through no hep, we'll be much more likely to achieve the overall target. So, as a community, we're asking you to sign up to no hep. At the end of the month, the World Hepatitis Day website will be launched. We're asking you to use the no hep logo across your website and on your materials. As Raquel mentioned, this platform is supposed to be used across everything that's to do with hepatitis and anything that's working towards elimination. So use the no hep logo, use the materials that are available, the different resources. They're all there in the 7 WHO languages. So they're free to be used throughout different activities throughout the year. Use the hashtag NoHep, as we've heard a lot now about social media today and the importance of it. We want to replicate what HeForShe has done in the first week. We want to use the hashtag NoHep and really elevate our conversations worldwide, and then connect as we're doing so. And then join us on NoHep Facebook page and follow us on Twitter, which will be launched on World Hepatitis Day, and get involved. Anything from launching it in your country, or else just sharing your conversations online. We really it begins with one step, and that just means signing up and joining the movement.
So Tara, if I understand correctly, this isn't just for the patients, member organizations of the Alliance. This is anyone in the world working on hepatitis should take the no hep materials the way the Red Ribbon and other.
Exactly.
Yeah.
And general public.
Yeah,
right?
yeah.
This is beyond, I would say, the people working hepatitis. I think it goes, what we want to do is raise massive awareness. So, so we get to the elimination goal.
Exactly. That's the thing. And Jeff, this isn't a World Hepatitis Alliance initiative. As I mentioned, just to reiterate again, it came from the hepatitis community, this big appetite to develop a movement. And we as the Alliance have taken it up. We've responded to this call by developing this initiative. But the success of this initiative is based on collective action beyond patients, going into different remits amongst different stakeholders. And it'd be interesting to hear what Elizabeth also has to say about that. And I know gender equality, half the world, it's a bigger remit than viral hepatitis, but it's about moving beyond the usual structures. And that's why we've developed no hep as a very strong, positive motive movement. And the campaign you'll see once it's launched is very uplifting and moves away from traditional health campaigns into something that we hope will capture the imagination and the attention from across the world.
I was attentively looking at Monica's face. This is the first time we're unveiling it. So, Monica, what do you think at a national level? Does this work?
Are you going to be able, Monica, I'm counting, or Tara, I'm counting like 15 weeks until World Hepatitis Day. The website we're still waiting for and the materials.
Yes.
So there's a lot of pressure, but do you think, working, as I think even a volunteer in your organization, are you going to be able to adapt and incorporate this for your World Hepatitis Day materials? How does it even work at the local level? Do you need like a board approval or?
Well, for us, it will be wonderful to be able to use that information. And I hear it's going to be available in many languages, Sarah?
Mm-hmm.
Is that correct?
Yes. 7, our usual 7 WHO languages.
Very excellent. So hopefully Spanish is one of them.
It is. Yeah. But we also have a customizable tool that allows you to add more languages. You can design your own poster with the No Hep logo and in your own language as well. We want to make this truly global campaign.
Yes. The vision
if we can keep collaborating and maybe join this new campaign to No Hep, to Hepatitis Zero, and all the things that we've done so far in different other countries. So we have like a global thing, but other things are going on, so we can just add it up so we don't need to rebuild everything again.
That's exactly it.
Yeah, my understanding is there won't really be any control. The No Hep material will be there and you'll link it, to what you're doing. So if it's a Hepatitis Zero or whatever campaign you have, you would latch it on. Elizabeth?
Yeah, so I just also wanted to thanks, Tara, for the presentation. Actually, it's quite inspiring. But one of the things that was going through my mind as you were presenting this is, and this is something that we have been trying to find sort of the way to do this on HeForShe. We started with this idea that you simply can't change the world with only the people that you like and those that like you, right? Which is why we started reaching out to men as well. But we also know that sometimes it's not easy. I think sometimes it's not easier for people that are not affected with the situation to care about it, right? Which is, again, the issue of gender equality, that some men are, if you're the boss, if you're getting, a good salary, perhaps it's difficult for you to care about unequal pay. And so I think one of the things that, you may want to think about is, once you get someone's attention, somebody who's not affected personally by the situation, what are the call to actions that you want them to do, especially if you have this, no Hep Zero goal in mind? Because I think social is fantastic, but you need to also think about concretely, how can their voices, the people that are not already in your corner, be able to either influence policymakers or influence people that make the decisions to actually make sure that they are aware, the awareness translates into concrete action.
Yeah. That's something that, very, very true. And we are, through our kind of strategy and our vision, we're trying to get to that point as well, ensuring that, as I mentioned at the start of this presentation, move beyond the clicked activism and have concrete actions out of it. As mentioned, this is the first time this strategy is likely to be adopted, and it's an important time for us to actually have a tangible opportunity to make something happen. So it's about coming together and making sure that actions are taken by the community.
So what are the concrete next steps? We've jumped forward to World Hepatitis Day where it's launched, but I mentioned we have about 15 weeks by my count to launch it. So what's up next aside from some really long working days?
Well, as mentioned, at the end of the month, the World Hepatitis Day website is launched and all the materials will be available then. So we urge people to download them, have a look at them, see how they can translate it for any activities for World Hepatitis Day. We're also, as I mentioned a few times, the World Health Assembly is likely, this elimination strategy is likely to be discussed on 27th May. We'll be producing a very educational, illustrative, animated video, which really distills the strategy into kind of a way of that we can really adopt it as a movement. So that could be quite interesting for a lot of people to really share it ahead of World Hepatitis Day. And then on the World Hepatitis Day, HeForShe will launch, and that'll be a global launch. And we hope then that we'll see our members really take it up and beyond, start doing it start really launching it in their countries. And as I mentioned, social will be very important. But then next year we also have the World Hepatitis Summit, which is also coming up. So that'll be another chance to really regroup and think what in the first couple of months, what's been going on, what do we do next? And we're also working at pulling together a multi-stakeholder working group, which incorporates people from across the different issue areas in viral hepatitis, which will be really important and intrinsic to make sure that this movement keeps its integrity and moves and evolves across, alongside the different issue areas in viral hepatitis.
So what I'm hearing about is a really, organic, bottom-up, process where you've launched it and you're not exactly sure where it's going to go, but you have a plan already leading up to World Hepatitis Day and into the next World Hepatitis Summit next March.
Yeah.
But we've also heard from Elizabeth about, I don't know, Elizabeth, if you would describe your movement or the movement HeForShe as more top-down, but it comes from the UN and engages really well. Over 1 billion people have been engaged. So what works, or how do we do both, or how can the movements be combined? Not necessarily hepatitis and HeForShe, but the bottom-up and the top-down approaches.
I think personally for me, what has worked very well with HeForShe was the people's movement aspect of things, because, it's revolution are not usually started by people that are in comfortable positions. They are started by people themselves that find themselves experiencing inequality or injustice. And so when we launched HeForShe, really, it was never, at the moment, there was never any focus on the top down. It was really about how do we get every single person involved, right? How do we get a man in Mumbai or a man on the streets in Harare or in London to actually care about this? And actually what was then a big surprise was to also see that this resonated with men in leadership positions. And we started to get, literally in the first week, the Secretary General of NATO signed on to HeForShe, and he put out a press release which was organic, nothing to do with us. The EU, the Secretary General of the EU Council did a similar thing, where the entire EU parliamentarians go to Brussels and have a HeForShe event and had a big signing on moment. So at the moment we realized, okay, this is also having an appeal at the top down. So we need to quickly make sure that it's not a PR and a publicity, but rather, if you want to engage with the movement, then you also need to have some concrete commitments. So this is why we came up with Impact 10 by 10 by 10. But I think the power is really in the people. The power is really in the people, because as the UN, as you know, we engage heads of states. In fact, heads of states they are our bosses. We engage with them all the time. But you need this, right? You need the bottom up and the top down to move at the same time towards. But the energy of the grassroots cannot be underestimated.
Yeah.
Fantastic. Tara, how's this resonating with you? What's your plan? We talked about awareness as a policy lever, and policy can be driven from the bottom. It's often managed from the top. So, how will you engage with WHO? How are you engaging with governments? Is there a longer-term vision to get these kinds of commitments that Elizabeth was mentioning, these sort of commitments?
Yeah, absolutely. And when I listen to Elizabeth, I'm inspired. So that's my first reaction. When I hear about what you've done and how you've engaged these different types of audiences, it's something that obviously we, as a membership organization and as an NGO, aspire to do. But in terms of tangible, what we're actually trying to do, our first phase will be about bringing people on to the same level, about getting everybody who's doing stuff in viral hepatitis, bring them under this platform of HeForShe. That's our objective number one. So that's kind of a bottom-up approach. In terms of working with WHO and different organizations, the idea why we developed HeForShe, or why the hepatitis community developed HeForShe, was around the strategy, was to ensure that there was a strong advocacy line amongst all our messaging. So that this elimination strategy, which outlines its key targets and the goals, 194 member states are likely to adopt that in May. That's a strong message for us to use as an advocacy tool to ensure that these targets are met. And we are working with different organizations, and we have close relationships with the World Health Organization and different governing bodies to make sure that we're in line and working towards that path. And as I mentioned before, the development, although we want this to be an organic and an evolving movement, the idea would be that a multi-stakeholder group will make sure that it goes down the right kind of path.
But also, just to reiterate, sorry, go on.
I think one of the things also you may wish to consider is how identifying your role model / catalyst, right? So people like to be recognized, and I think especially the member states, as you're bringing on board member states to sign on, I think identifying 5 or 10 that become your spokesperson, that become the role model, and then by recognizing them, also they can ensure that they are intensifying their efforts and actually creating this role model behavior that will encourage other people to follow through.
Yeah, there are some member states that the Alliance has been engaging with that are real leaders. We hope there'll be many more. There's a lot of intense efforts going on. Raquel, I can give you just 30 seconds, and then I need to start wrapping up.
30 seconds, it's not more than that. You can even time it. But it was just to reiterate what Monica said around, tagging these onto existing things. So this is not, now you forget everything you've done, focus on HeForShe. No, you can add your logo to your own existing campaign. That already is fantastic. It was less than 30 seconds.
Oh, well, CEO. So, we started off talking about awareness as a policy lever, and we end up with, hearing about the launch of a global elimination movement, a movement that should run until 2030, and that is aligned with the new WHO Global Health Sector Strategy on viral hepatitis that we expect to be approved by the world's governments in May. So I think it's a really fantastic time and historic moment for us. It was great, Monica, to hear about the street activism. I'm sorry we need such activism, but it's great that people like you are doing that, and in Chile and raising awareness there to the point where the government's extending meetings and feeling overwhelmed by your emails. You really did something, and were able to manage the message throughout the process. So thanks so much for joining us. And you were also at the World Hepatitis Summit, I remember, and a part of those discussions saying we need a unifying global movement. We need to do our own thing, but we need to do it under a giant single banner. And Elizabeth, well, HeForShe is so impressive, and you've done such great work. So congratulations, and thank you for sharing the story with us. I think the Alliance will be back in touch with their partners, so I hope you don't mind, for lots of tips throughout the process, particularly engaging with the UN, engaging with celebrities, but also all the creativity that really drove and continues to drive your movement. And Raquel, of course, giving us this overview, talking about social media. There was one question that came in I didn't have time to ask, but for you to think about, which was, does the Alliance or others recommend people to follow on Twitter, sites to like on Facebook and Instagram and so on? Because there's a lot of confusion sometimes and traps and fake things out there, and we want to make sure that people are following real thought leaders, as they were described, but also other just interesting people in our field. And Tara, well, congratulations. I expect this is going to be an exhausting month to 15 years for you.
Yes.
But you're launching, and we're all launching this incredible HeForShe global elimination movement. So thank you so much for walking us through what this is about, where it came from, and where we hope it's going to go. To elimination as a public health challenge, and in some countries even elimination completely. So thank you for all the participants, for the questions and comments that you've been sending in, for staying on the line at this late hour for some of you, or early hour for some of you, lunch hour for others. We are recording this. There'll be a video available, and the Alliance will let you know where that video is, along with the previous 2 webinar videos, so you can follow it. You can cut parts out. It can be useful as a pedagogical tool to share with new colleagues, to share if you're teaching, and so on. And let me also thank, since this is our third, and for now, sort of final, I should be advancing my slides, thank you, as we sum up. A final, webinar in the first part of the Tools for Change series to everyone at the Alliance and others who have provided practical support in getting this to work, I thought it would be really easy to do a webinar. At least I could be able to log in and speak, but in the end, I've also required a lot of support. So thank you to everyone who's provided that support. So let me end on those words and thank you again to a fantastic panel and good luck everyone with the No Hep movement.
Thank you.
Thank you, Jeff, for being a fantastic moderator. Thank you so much, Jeff.
Thank you. Bye, everybody. Have a good day.